Hi, good morning, everyone. Happy Monday. Just wanted to, I've had quite a few requests to re-record this presentation, so that people can share it with their spouses and their children, which I greatly appreciate getting that feedback, and I'm more than happy to do so. But just want to let you know that there will be no live audience, so which is sometimes easier because people ask questions. So we're just going to roll with it and have fun. So this presentation is going to revolve around two topics, and one's telemedicine, and that's through Teladoc, who's our new provider, and the second one is sharing wellness information that I learned at a speaking summit with a national speaker from Orlando, Florida, who was excellent. So here we go. First thing's Teladoc. We chose Teladoc because they definitely are the industry leader in telemedicine. They're the first and largest provider of it. They have a 95% member satisfaction rate, a 94% physician satisfaction rate, 6-minute consult duration, 10-minute median response time, and 92% of the times the patient issues are resolved. So those are some great statistics for them, and we've had a lot of recent successes, actually, of people using it. We've only had it for a month, so, or not even through 2-3 weeks. So my husband actually used it, and it was awesome. It was over the weekend, and I'll share it with you as we go. But this is the national scale and coverage. One thing I do want to recommend or point out is for Texas. Anyone at our Arlington branch, you can only do phone visits. So everyone else can do both phone and video. But just know that Texas, you can only do a phone consult and not video. And I'm sure they're working on that, but due to regulations, I'm not sure when that might change. So when can Teladoc be used? Obviously, when your physician's unavailable, if they don't have any appointments, or if it is after hours and they are closed. If your schedule doesn't permit it, I know traveling can be an issue when people are traveling. You get sick. This is a perfect spot to use it. If you're on vacation or a business trip, if you if you need a refill of a reoccurring prescription, that would only be short term, or they may only give you a day or two of it until you get back home. And then pediatric care for any age. It's always great when those who have kids and they're sick and you don't want to take them to the doctor and get them sicker. So this would be a good spot for that as well. So imagine this. This is exactly the scenario that my husband had. He woke up and actually he had cold-like symptoms. He had a lot of congestion in his head, and considered the options. He called Teladoc. So he put in a request, and 6 minutes later the physician called him back, and I think it was in 6 or 7 minutes. The physician said, "Yep, you got a sinus infection. I'll send in your prescription." And 20 minutes later, he went to Walgreens and picked up his prescription. It was super duper easy. The best part about it is it's free. So PJ is picking up, or this is offered as a benefit to any PJ employee, spouse, and children. So you don't have to be on the health insurance plan. It's really for anyone. So it's very slick. It works really well. I think I skipped a slide. Maybe not. So oh yes, I did. So this, how does Teladoc work? So the first thing you have to do is complete your medical history. It takes about 5 to 10 minutes. It's super easy. So you have to actually register on Teladoc. So I highly recommend just doing it on their website, www.teladoc.com, and complete your medical history. And that's you can't request a consult unless you do that first. So you do that, and then you request a consult, talk with a physician, resolve the issue, and then continuity of care. That is, so anything that is talked about or noted by the physician, you can have sent to your primary care physician. So I highly recommend that if you do have a primary care physician, you do send that so they kind of are apprised of what's going on. And then reconcile account if necessary. That's crossed off because, like I said before, PJ is paying for it. So you should never pay for anything with Teladoc. You should always have a zero balance. So effective resolution to a wide range of conditions. So the top diagnosis for Teladoc are sinus problems, urinary tract infections, pink eye, bronchitis, an upper respiratory infection, nasal congestion, allergies, flu, cough, and an ear infection. And then prescriptions as needed. They aren't going to just prescribe to prescribe, especially they definitely won't prescribe any controlled substances, psychiatric or lifestyle drugs. So to just know that. And they do prescribe generic 98% of the time. So these are the reasons why most people call Teladoc, but you can call them for anything. It doesn't have to be just one of those things. It really can be for anything. They do have STD lab testing. That's an enhancement of their core services, and that's no additional cost. It's fully confidential, and then the post-test doctor consultation is included in the test fee as well. So, and nothing comes back into the Teladoc's member portal or for their medical history. So just know that. Video links, there's some cool videos out there. One's 5 minutes, one's about 2 minutes. So if you want to watch anything else about Teladoc, you're more than welcome to. But really all you need is a webcam and internet access. Actually, your smartphone, I highly recommend downloading the app. It's just Teladoc. If you search it, it's awesome. You can just do your video consult right on there. So you don't have to remember or log into your computer. So I highly recommend using that app. They have it. So what's next? So you can register and complete your medical history online. You can call them and register, or the app. I just recommend going to teladoc.com on your computer and filling it out. Like I said, you can't request an appointment until it's completed. And the primary account holder, which is all of you, the employee, needs to register first, and then you add your dependents, so your spouses and children, under the My Family section. They'll immediately then, anyone over 18 will immediately get an email sent to them for them to register their own account, and that's due to HIPAA. And then should you want to give access to someone, a spouse or grandparent or ex-spouse or anyone, you can do that under schedule consult, or you can do that under the authorized consenter screen. So, and I'll show you, I have a screenshot of that. Like I said, you can request an appointment a bunch of different ways online by calling their toll-free number or their app. And not every consult, like I said, will result in a prescription. So if you have some type of virus, they may not, they may say just wait it out. But yeah, they'll direct you in your care or have aftercare instructions if there's a prescription, or direct you if you need to go see a doctor. And like I said, I think I mentioned all of those. Prescriptions work just like it would if you went to the normal doctor, and it runs through our pharmacy benefit manager, and it's sent directly to them. Super easy. Welcome kits, everyone should get a welcome kit in February. I haven't seen them yet, but you don't need that to start using Teladoc. So please just register is the first important thing. So here you go, register and complete your medical history. This is at teladoc.com. You'll see this purple screen, and here it says sign up for an account. That's what you click on, or set up account. You'll go to this screen, super easy, your name, pretty simple things, name, email address, phone number, date of birth. You don't have a username, and then it says my employer insurance provider offers me access to Teladoc. That's what you want to check, and then under here you just type in company name, Palmer Johnson, and then select it when it drops down with Palmer, and hit continue. And then you enter your account information. So this is a lot of standard things with your phone number and your email address, and then you hit set up your account, and you're completed. You're done. Then you do your login information. So you always want to have write down your username and password. Have it be maybe similar to PJ. Whatever you need to do to remember it. Please just document it and put it somewhere, because we can't help you with that. As far as if you do forget it, we can't help you. You'd have to call Teladoc, and then you electronically sign. And so that's three screens in your setup. So you're registered, and then it comes to this screen. There you have 3 things you can do. So from there, if you can click on complete my medical history, that would be great. And just do that. It won't take long. It's about 5 minutes. But just note, if you have a primary care physician that's just a general medicine doctor, select the specialty type family medicine. There's about 200 different doctors in there. There's a lot. So just know, if you do have a primary care physician, you can select family medicine for that. And then it's going to go to your screen when you click on my medical history. So you have an overview, my medical history, my family, my account information, and my message center. So this is where you, my medical history, you click on this for your health records, and you can put your doctor, your primary care physician if you have one, and your pharmacy information right in here. Under the My Family screen, this is what's most important for all of you to really remember. For Add a Dependent is right here. You click on Add New Dependent. So that's where you add your spouses or your children onto your account information. This is the medical history, super easy, height, weight, if you're on any medications, allergies, and they'll ask you a few other things below. But for anyone that uses Teladoc in the first maybe 2, 3, 4 months, if you can let us know, call or email us to see what your thoughts are, if you've used it, if you have any hiccups or good or bad experiences, we definitely would appreciate the feedback because it is a new benefit, and would love to hear from all of you. All right, now I'm going to switch gears and talk about the wellness speaker that I listened to. And he's based out of Orlando, Florida. He was great. His name is David Mines, and his whole talk was about, is it possible to add 10 bonus years to your life? And he definitely thinks so. And the whole point is our average lifespan is definitely getting longer. In 1960, we had 3,100-year-olds, and today we have 80,000. But if you're a baby boomer, the average baby boomer will be 100 in year 2050. So it's definitely going to affect longevity and our society, because we're going to have 1 million 100-year-olds in the United States. And for those that don't smoke or drink excessively, the number one thing you can do to increase your years of longevity is really by what you eat and what you put in your mouth. So this is where it gets participative, but can anyone guess what the top 3 health issues are facing America? So think in your head what you think they might be. And a lot of the same ones will come to mind for people. The first one is cardiovascular disease. It's the number 1 killer in the United States right now, and that is really a heart attack and stroke. So if you think about it, if you've ever been to the Vietnam War Memorial, there's 58,000 names on it that got killed in the Vietnam War. This is the same number that die from heart attacks and strokes in the United States every 3 weeks. Every 3 weeks we have 58,000 people die. That's crazy and pretty scary to actually think about. Every 1 minute, someone in the U.S. dies from a stroke, and every 40 seconds of a heart attack. But can anyone guess what the first symptom of a heart attack is? Most people in my 3 webinars that I've done guessed chest pains or left arm tingling. And it's actually, those are great guesses, but it's not. The first symptom of a heart attack is death. I know that's morbid and that doesn't sound really great, but 64% of women who die suddenly have absolutely no symptoms before they have a heart attack, and 50% of men. So that's pretty scary to think about. And actually, for men, the symptoms for men and women are different. So men get chest pains, that tingling down the left arm are the most common. For women, it's unusual fatigue, unexplained anxiety, and then you can't sleep well for about a month prior. So think about that, and remember that: unusual fatigue, unexplained anxiety, and you can't sleep for about a month prior. Now, don't all of you think you're having a heart attack, but just keep that in the back of your mind. And then actually when the heart attack happens, the symptoms are different. It's shortness of breath, abdominal pain, and sweating. So lots of times for females, it often goes misdiagnosed, and it's like, oh, go sit over there in the waiting room. I want to help a male who has chest pains in the left arm tingling, when it does go misdiagnosed. So think about that as well: shortness of breath, abdominal pain, and sweating while a heart attack is happening. So inflammation is what actually brings on the event of either a heart attack or stroke, usually. And people used to think that it started with clean arteries, and if it clogged everything up to actually cause that heart attack. But they now know that the disease starts years and years before in the arterial wall, and the blood flow remains perfectly fine, and this is when it usually is caught. But what happens is you really want to catch the plaque when it's in that arterial wall so that it doesn't explode or rupture from inflammation. And inflammation is due to lack of activity, tobacco, stress, lifestyle decisions, poor nutrition, you name it. And what happens is then that ruptures and goes into the bloodstream. So in about 90% of cases, people that had a heart attack or stroke had clean arteries 1 minute before. So if you know you have this, then you can do, if you know you have plaque and inflammation in your wall, you can do things to control that inflammation so that the plaque doesn't have to break, so that you don't have an event or episode like a heart attack or a stroke. And most doctors are great at trying to keep people alive after it happens, but it would be better to prevent it by looking at the arteries. And there's a test that's called the carotid IMT test. And I'll talk about that on the next slide. Okay, so carotid IMT tests. So really, how does this work? So I'll show you a picture on the next slide, but it's a condition in which fatty material collects along the walls of all your arteries, and this fatty material thickens and it hardens and it forms its calcium deposits that may eventually block the arteries. Doctors can use CIMT, or doctors do use it, and it's an ultrasound test, and it's being recommended by the American Heart Association for heart disease in healthy individuals at ages 45 or greater. It really could be for anyone, depending on what your risk factors are, and I'll share those in a minute. But it provides a window of the coronary arteries, and it's an independent predictor of future cardiovascular events like a heart attack, cardiac death, and stroke. Totally non-invasive. Like I said, it's an ultrasound, and it takes about 15 minutes to do, or 15 to 20 minutes, and it's definitely painless. And like I said, it's good for a bunch of different risk factors, and I'll talk about that in a minute. Because stress tests, I should note, stress tests in a research study that they did, I think it was over ages 55 and up, 68% of the time stress tests missed what it needed to miss. So because it wasn't that progressed or advanced. So all of you have heard of someone 45 years old, absolutely amazing shape, triathlete, runner, whatever it might be, just dies of a heart attack instantly. And that's because they had plaque in their artery wall that ruptured and caused that event to happen when they didn't even know they had plaque in their arterial wall. So individuals with the following risk factors have elevated risk for heart attack, stroke, or any type of cardiovascular disease. And if you do have many of these, or 2 to 3 or 4, 5, it may be good to talk to your doctor about the carotid IMT test. I'm trying to see if we can possibly get someone to come here. I found a lab that actually does the CIMT testing, to see if we could do it possibly this year with our health risk assessments for everyone, and getting proposal back, and depends on the cost. But please note, you can get this done through your doctor. It is usually covered by insurance, but there will be a cost to it. So risk factors are family history of heart disease and stroke, overweight, increased cholesterol level, high-fat diet, tobacco user, high blood pressure, diabetic, metabolic syndrome, erectile dysfunction, psoriasis, and rheumatoid arthritis. So this is what it looks like. This is a healthy artery. This is where this buildup begins, and this is where the plaque forms. It's this little wall right here. And then when plaque ruptures and a blood clot forms, you can see it right there. So this is a normal ultrasound on this side. So this is what the CIMT is. It's an ultrasound, and this would be what the images would somewhat look like. So this is normal, and then this is where there's plaque. You can see this little spot here, and then when that plaque keeps growing and growing, and that's what ruptures and causes the event to happen. And so, and all of you are thinking, okay, so if I did have inflammation or plaque in my arteries, what would I do? And typically it's diet and exercise that will control that. Now, if it's really advanced and progressing or really far along, it might be medications as well. But heart healthy lifestyle changes really is all about what you eat, managing stress, physical activity, and then no tobacco use. All right, so we're going to move on to the number 2 killer, but know that is a preventative measure that is out there currently that you can use, and we'll keep you posted on if we can get those and do those in-house. And it's really neat because it actually, when they do the testing, it will tell someone what the age of their arteries is. So then you know how much plaque that might be there, and then know how to, well, hopefully to control it then would be the goal. The number 2 killer is cancer. So one of the main things you can do to decrease the risk of cancer is really by eating more plant-based foods and eat food closer to the way it grows. So you should always, the best thing to do is shop the perimeter of the grocery store, because that is where typically all of the good fruits and vegetables and foods that have, I would say, less artificial junk in them are modified. They're definitely less modified. But a steak has the same calories. If you think about some of these things, a steak has the same calories as 7 cups of pasta and 7.5 potatoes. I guarantee if all of you sat down, I bet you could not eat 7 cups of pasta or 7.5 potatoes. So it's all about moderation and choosing what you eat. And then it's about how it's cooked. So 2 baked potatoes have 250 calories versus a bag of potato chips is 1,200 calories. A 4th cup of raisins has 100 calories, or 1 cup of grapes. So 1 cup of grapes might fill you up longer than that 4th cup of raisins. So you really want to just start eating more plant-based foods, which is fruits, vegetables, and grains. It decreases anxiety, increases productivity, you feel better, helps your weight and diabetes, especially your blood sugar. And this was interesting. If you don't like, some of you don't like eating vegetables. And David's point was you really just need to jazz them up. He said eating any vegetables is better than eating none at all. So we have what's called this, he had us all take a lab testing strip and put it on our tongue. And if it was a bitter taste, you called a super taster. And I'm a super taster. So people that are super tasters tend to, they're less likely to be smokers, and they're also less likely to like vegetables because of that bitterness in some of the vegetables. So broccoli, for example, can be a little more bitter. And his point was add cheese sauce on them. Put cheese over it. Because like he said, eating the vegetables with cheese or something else, you know, whether it's that bag of potato chips, vegetables are way better and healthier for you. So really, the best thing you can do to decrease your risk of getting cancer is by what you actually put in your mouth every day. And the number 3 killer in America is obesity. And this, I thought this was a kind of a neat graph to show in regards to drinking soda. It increases the risk of heart disease by 20% in men, the risk of diabetes by 25% in women, and for all, the likelihood of being overweight by 27%. So how does obesity affect your body? And you can see this chart, but can any of you guess what the average weight was? Think about this in your head. In 1960, the weight of an average man. And when I did this before, I got lots of different answers and guess, and 170, 180, 200, whatever it might be. It was 160 pounds in 1960, and the average today male is 196 pounds. So think about that. 50 years later, or 55 years later, the average male is 36 pounds heavier today than back in 1960. And then women, the average in 1960 was 140 pounds, and now today it's 164 pounds. The average 10-year-old is 10 pounds heavier, and 1/3 of all kids in school are overweight. Think about that. 1 out of every 3 children are overweight or obese. And the average Americans eat 500 more calories per day than they did in 1970, and 53% of that's coming from fats and oils. So how do you lose? And then I should say 37% comes from flour and sugars as well, 10%. So how do you lose weight? And it's really, you have to eat less fat and sugar by cutting out. One of the best things you can do is cut out condiments. So the mustards, the mayos, the ketchups, the salad dressings. But what also is happening is the average American is getting a lot more sugar in their diet. So, and typically it's 300 to 400 more calories a day that people get in sugar, because sugar is in everything. And then saturated fat it's a problem. Saturated fats from animals, like steaks, butter, and it makes your cholesterol go up. So 50 grams of fat is a good target for people a day, and the average American right now gets 82 grams a day. So the whole point is you don't have to turn your life upside down. It's all about moderation and choosing what you eat, and just maybe not having a steak every day, but maybe once a week. This was, I thought, a great quote. He said, "You make your sick care decisions at the doctor and your health care decisions in the grocery store and the restaurants." And also pointers back to sugar, and really starting to look at labels. So 1 teaspoon of sugar equals 4 grams of sugar. 2 teaspoons of sugar equals 8 grams of sugar. So he had examples of different cereals. Shredded wheat has 0 grams. Crispix has 4 grams of honey. This is per serving. Puffed wheat is 0. Probably doesn't taste like much, right? Maybe shredded wheat doesn't taste like much either. But Honey Smacks has 15 grams per serving. So think about that. 15 grams per serving versus 0. So it adds up fast. Same with yogurt. Yogurt there's a lot of I shouldn't say hidden. There's a lot of sugar in it if you look at the labels. So start looking at your labels. Nate Schultz said he started cutting out sugar, and it made a big change for him, and it helped him lose a significant amount of weight by just cutting out sugar, helping reduce sugar in his diet. And he recommended Fed Up. It's a documentary, and a couple people said that they've seen that and said it was really good. So if you want to learn more, watch the Fed Up documentary. But his point was use the sugar bowl. So David thinks it's best if you actually buy the cheaper, because it's cheaper and healthier, the unsweetened form of whatever cereal you might want. So buy that unsweetened form, and put a big sugar bowl next to your child and tell them to go wild. He said most children won't add 4 teaspoons of sugar to a cup of cereal. They just won't. And if they do, the best part of it is most of it will be at the bottom of the bowl. So you can keep a lot of those teaspoons and a lot of that sugar out of your child's body. Whereas if you're eating Honey Smacks, you're getting that sugar because you're eating all the Honey Smacks, and it's not the sugars in the actual cereal. So something to think about, to keep in mind. What other problems are there with obesity? And that is the weight gain. So, and that's due to a couple factors. The cost of food. So he had this scale and showed, and this is where it's participative in asking you how much of your budget do you think you spend on food? What percent? And I got a whole bunch of different guesses, about 20, 30, was around the average. And actually in the U.S. it's 8%. So food is a bargain here in the United States, and that's because it's always available. There's a lot of fast food restaurants. Whereas in Belarus, that had the highest amount, and the highest was 50% of their total budget. So food's very expensive there, and the U.S. was definitely at the bottom of this scale. But another factor is as serving size are getting bigger. So the Gulp, I've never had it, but I think it's like those big Gulp sodas. I've seen people here with them, which is totally fine. But just so you know, one of those Gulp sodas has 45 teaspoons of sugar in it. So the next time you go to get one of those, think about that and what it's doing to your body. And the average American spends $850 a year on soda. So if you can take that $850 a year and cut soda out and spend it on fruit or vegetables or something else, sparkling water that would be maybe better for you, that would be a great way to just cut one thing out. And then the problem with the bathroom scale. So he's not a huge fan of people weighing themselves and being obsessed with themselves on the scale every single day, because his point was you can have a 6-foot male that's 200 pounds, very lean, bodybuilder type, and then another one that maybe has 180 pounds, but has a really big belly. So his point is he really likes when people use the tape measure to determine your health status, because gut fat is a dangerous fat, and actually it's really dangerous for you because it's metabolically active. So men that have more gut fat, you can lose it pretty quickly, but that gut fat raises the LDL and cholesterol for people. And the bigger your gut is, the chances are much higher to get high cholesterol, high blood pressure, and diabetes. So Where do you measure? So, and his point was it should be 35 inches or less for females and 40 inches or less for males. Well, most people measure at their belly button, and that's the wrong spot to measure, he said. So if you feel down at your hip bones, so if you feel your hip bones, everyone feel their hip bones, you feel those, at the top of your pelvis, so right at the top of your two bones, that's called the iliac crest, and that is where you actually measure your waist, not at your belly button. So hopefully you guys know where the correct place is to measure it, but do that and see where you land on the scale. And like I said, 35 inches or less for females and 40 inches or less for males. All right. Artificial sweeteners. This topic came up during his talk, and he said, because someone asked, what are your thoughts about artificial sweeteners? And he said people that use them tend to gain weight, which is very interesting. And he said it's because of the gut bacteria. Artificial sweeteners affects the gut bacteria, and it affects the immune response. So you have more organisms in your human gut than you do in your whole body. And plant-based foods gives you a better microflora in your gut. It can help you lose weight and can help with diabetes. And artificial sweeteners, what they do is they tend to change that gut bacteria. So he recommended another better option is an all-natural sweetener called stevia. You can get it at any grocery store, Woodman's, Target, you name it. It's an all-natural sweetener called stevia. Truvia and Purvia, they're just forms of stevia. So if you see any of those, stevia, Truvia, or Purvia, that would be better than a sweetened loaf, for example, or some type of artificial sweetener. Put more physical activity in your lifestyle. So this is all about exercise, but exercise reduces the chance of obesity, heart disease, stroke, certain cancers, osteoporosis, decreases the risk of getting cancer by improving your immune function and your hormone levels, and increases your mood and mental outlook. One study found that being inactive gives you the same risk for heart disease as if you smoked 1 pack of cigarettes a day. Think about that. That's kind of crazy to think about. Walking is the best exercise that you can do, and it's free, doesn't cost you anything, but really find something that you really like to do or you enjoy doing, and that varies by individual. But this was interesting. Sedentary people lose approximately 40% of their muscle mass and 30% of their strength. So if you sit and don't move, so 40% of the muscle mass and 30% of the strength between ages of 20 and 70. I was fascinated by that because I thought it would be older, not 20 years old, but starting at about age 20, you begin to slowly lose that muscle mass, and that contributes to a lower metabolic rate and an increase in your body fat. So it takes really resistive exercise and some strength training to build that back up. But exercise can help. And it reduces blood pressure and inflammation and improves your cholesterol levels. Okay, I think I have everything I wanted to cover on that slide. These are just different benefits, exercise benefits, 20 exercise benefits, and reduces your body fat, your lifespan, strengthens your muscles, manages chronic pain, wards off viruses, reduces diabetes risks, strengthens your heart, cleans your arteries, boosts your mood, maintains your mobility or your flexibility, improves your memory, coordination, strengthens your bones, improves complexion, detoxifies your body, decreases your stress, boosts your immune system, lowers your blood pressure, and reduces your cancer risk. So great reasons to exercise. So tips to be healthier: weigh yourself, but don't be obsessed with a scale. Eat breakfast every day. That's super important because that's what triggers your metabolism to go. So if you don't eat breakfast, your metabolism isn't going to work very well throughout the day. So that's why they always say breakfast is the most important meal. And you don't have to eat a big breakfast. Even if it's just a glass of orange juice or a hard-boiled egg, something you don't have to make a big breakfast, but anything's better than nothing. Exercise of some sort, and he was saying it doesn't have to be much. So 150 minutes of low intensity, so say that's 30 minutes a day, 5 days a week of walking, or 75 minutes per week of moderate intensity. Smaller meals and eating them more often will also help increase your metabolism and keep that metabolic rate high. Sleep-deprived people eat more calories per day. That's an interesting concept, and if you think about that, so sleep is super important for your health, for your mental sharpness, But if you think about it, and you don't sleep, you have to eat more calories per day, because that's how you're getting your energy to function. So sleep is really extremely important, and I know it can be hard, but if you can get 8 hours of sleep a night, that's ideal, if not longer. But and type 2 diabetes, it's nearly half of the United States has prediabetes or has diabetes, and you don't suddenly get it, and you're not, and insulin resistance is the precursor of it. So fasting blood sugar is what people often use to see if you have if you're pre-diabetic or have diabetes, but it's not super predictive. That is what we use. Our fasting glucose is what we use for our health risk assessments, and it is very standard. It's used pretty much across the board everywhere in physicals, most people's physicals as well at the doctor office. But the best predictive value of this is a two-hour glucose tolerance test, and that's usually covered by insurance. But you have to do that when you're pregnant to see if you have gestational diabetes. And you drink a drink. It's a really sugary drink, and they test your sugar. They do your blood work and just test your level after 2 hours of that, and see how your body processes that. Another way you can know if you have diabetes or are pre-diabetic is you take your triglycerides, divide them by your HDLs, and if you're greater than 3.5 for Caucasian, your insulin resistance, or greater than 3 for Hispanics. And then also if you have 3 or more risk factors, and you probably are insulin resistant. So recap, you want to eat more plant-based foods, fruits, vegetables, nuts, and whole grains, and closer to the way it grows. Remember, shop the perimeter of the grocery store. That's typically where the best, healthiest foods are. You can pass a stress test, but you can still be in trouble. That carotid IMT test could be important maybe for some of you. And maybe, like I said, hopefully, possibly we'll get that this year for our HRAs, because I think it'd be fascinating to know personally how my arteries look and what age they are as well. And I think it would be helpful for many of us, and we could prevent those heart attacks or strokes from happening. We had a couple employees unfortunately pass away in the last 3-4 years that this could have maybe been prevented had they known that they had plaque or inflammation in their arterial wall. Eat less sugar and fat. Start using a tape measure, not the scale. So remember your hip bones, at the top of your hip bones, that's where you want to measure that crest. Consider the 2-hour glucose test for people that are concerned if they maybe have diabetes or are pre-diabetic. Start moving. Exercise definitely helps. And just wanted to finish it off with, you can be 40 years old and over the hill, but you can be an 80-year-old youngster. And the best thing you can do is die young, as late as you possibly can. So I hope you all enjoyed the presentation. If you have any questions in regards to telemedicine or Teladoc or any of the wellness information that was shared in this presentation, feel free to call, text, or email. All right? Thanks so much. Have a good day.